So this is a study about kidney complications associated with youth onset type 2 diabetes, and this study was designed to look at long-term outcomes once children are identified in the pediatric age group and then followed into the adult world. Type 2 diabetes is a relatively new disease, first identified in the mid-1980s, so it's only been around for about 30 years. So we're still learning about what the true risk long-term is as far as complications. So this study was designed to look at what the risk of kidney failure is in a group of youth with type 2 diabetes diagnosed prior to 18 years of age compared to a group with type 1 diabetes, as well as a matched by age, sex, and postal code group without diabetes. And so we sought to look at what the risk of kidney failure is long-term, as well as what clinical risk factors are associated with progression to kidney failure, and also to look at survival in the three groups. So in Manitoba, we have two unique data sources that made this study possible. The first is it's a clinical registry housed in the Diabetes Education Resource for Children and Adolescents at the Children's Hospital. And this is a clinical registry that was started in the 1980s and has been collecting data on children since that time. We were able to identify youth specifically with type 2 versus type 1 diabetes in that registry, and then we were able to link their healthcare records using administrative data, which is housed at the second data source, which is the Manitoba Centre for Health Policy, to look at their long-term outcomes. So what we found was that the youth with type 2 diabetes have a higher rate of early markers of kidney disease or albuminuria prior to 18 years of age, and we found that those with type 2 diabetes compared with type 1 had a 4 times increased risk of kidney failure into early adulthood. We found that blood sugar control and obesity are important risk factors for developing kidney failure in early adulthood, and we also found an absence of other risk factors that are very important in adult groups, such as hypertension. We did not find that to be significant in our study, which is important and bears further study. We also found that of those youth that had 20 years of follow-up, 50% of them were on dialysis. So there's a very high risk of progression to needing dialysis in youth with type 2 compared with type 1, where we had very few outcomes, and also to a matched control group, which is similar as far as geography or presumed ethnicity, so much higher rates of kidney failure. We also found that the youth with type 2 had higher risk of mortality, so about 1/4 of them had already died if they reached that 20 years of follow-up, so much higher risk of kidney failure and mortality. This study is important because it was the first study to look at longitudinal data over time to identify the true burden of disease in these youth. Youth are not protected from all the complications that adults have with diabetes, and they seem to have earlier onset of complications and develop end stage when they're in their height of their productivity in their early adulthood. So it highlights the risk associated with type 2 diabetes in youth and the importance of identifying youth early and to modify their clinical risk factors to delay progression to end stage. So it's the first study to really raise the awareness about the true burden of disease in this population.